When I all know, say a few weeks ago, it pleased His Excellency the President for declare Salone that we get a public health emergency. The President say we need to tackle this emergency head on. You know, I can say social media people their memory is short, so just 2 weeks ago, they post every day, and they tag with this country. Oh, they are not care about this. The leadership of Professor Foday Sahr, the leadership of His Excellency, and this team we put in place, quickly, when I jump into action, the government jump into action, we see some major things, including the town hall will be host. It bring the entire government together, and since then, you don't bring can together. Different pillars, a clear national strategy, a clear goal for really once and for all defeat this Kush epidemic we get.
We actually operate on 5 pillars based on the declaration of His Excellency the President. And then 5 pillars them. 1, now public information and risk communication. This particular pillar, now the Ministry of Information and Civic Education, together with the Ministry of Health, and then the leader pillar. And the main work are for make sure so they conduct nationwide campaign for increased access to accurate information on dangers of the use of drug or Kush. And the second pillar, now community engagement. This pillar is led by the Ministry of Local Government and Community Affairs and the Ministry of Health. The third pillar, now care and treatment. The Ministry of Health and the lead this pillar, and Ministry of Social Welfare, the co-lead. And the fourth pillar, now rehabilitation and reintegration. The Ministry of Social Welfare, the leader pillar, together with Ministry of Youth Affairs, and then the Ministry of Technical Higher Education. And the fifth pillar, we now one of the very important pillar them, now law enforcement and border control. Pillar leads them now the National Drug and Law Enforcement Agency, the brother Naya, together with the Sierra Leone Police and the Republic of Sierra Leone Armed Forces. One thing we want to emphasize now, district leadership. The district level response, it will be led by the district council chairperson or the mayor where appropriate, and co-led by the district medical officer. We don't want to create a new structure. One ride on the existing structure so that even after the expiration of the task force, the activities will continue. We establish for ourselves certain goals, and then goals were established for ourselves as a task force. One, now for make sure say we reach 70% of community nationwide with information on Kush. The second goal was set up for ourselves now for reduce youth drug abuse by 80% in the first 1 to 2 years. And 3, we want to establish at least 1 treatment center and 1 or 2 rehabilitation centers in each of the districts within the next 1 year. And 4, we want make sure say we support at least 70% of individuals who are in the past through this program for make sure say they go back to school or we integrate it at the family with their families or get them to work.